Hello, welcome to the Healthy Alternatives podcast. I am Dr. Christine Sauer with DocChristine.com. Today's show is a recording of my radio show of the same name. Enjoy! Good afternoon, this is Dr. Christine Sauer, your host of the show Healthy Alternatives here on 97.5 CIOE-FM with live stream on communityradio.ca every Thursday at 12 noon Atlantic Standard Time. Thanks for tuning in today. In this show, I will talk mostly with guests about all aspects of health, healthcare and wellness, from conventional to alternative and everything in between. My mission for this radio show is to help change people's lives for the better by informing them about different options to get and stay healthy and well so they can choose for themselves which option might work in their case. And if you feel you're stuck in a dark place, I want to tell you, don't give up. There is a light at the end of the tunnel for you too. So today I am extremely pleased to be with Dr. Josh Friedman. Welcome, Josh.
Thank you.
Now,
I'm thrilled to be here.
I'm thrilled to have you on because we are doing a lot alike and you're a very unusual psychologist. Now, you have more than 25 years experience in the mental health field as a client, psychologist, and a functional nutrition practitioner. So that is a very unusual combination. Tell me a little bit how you got into doing what you do.
It's sort of a long, interesting story. I'll sort of encapsulate it. So I was traditionally trained in New York. I studied a lot of what's called depth psychology or psychoanalysis, where you basically just are talking to people. Mm-hmm. And through my entire training, I don't think I ever heard one person mention food, how food affects the mind, how food affects mood. So 7 years of graduate school, 2 years of postdoctoral training, and no one ever mentioned the effect of food on mood. Mm-hmm. So, and of course, it wasn't something at that point I was even thinking about. I was thinking about people's relationship with their mothers. I was thinking about trauma. I was trained in the early mid-90s when the idea that psychological trauma was affecting people's mental health situations. Mm. And then so I went on my business. I took a job at a city hospital in New York. And then I went and took a job at an eating disorder center in Manhattan, a sort of quite famous one. And we were working with anorexic, bulimic, and compulsive overeating, mostly women, but some men sometimes. Mm-hmm. And at the time, my wife was starting to get into alternative medicine. She wasn't a practitioner, but went to see someone at the time, a chiropractor that was called a biochemical nutritionist, mm-hmm. that did a series of lab tests and prescribed supplements and lifestyle changes. And so she was also a writer, and I went to meet him once, and he sort of offhandedly said to me, "Do you know why your anorexic patients aren't getting better?" And I sort of didn't have an answer. I said trauma or their relationship with their parents or control issues. And he said, no, that may be part of it, but at its core, anorexics don't need enough protein. If they don't need enough protein, they don't have enough tryptophan. They don't have enough tryptophan and therefore not enough serotonin. And so for me, when I heard that, it was like huge.
Yeah.
And I got really excited. And he told me to read there's a book, he said, if you want to learn about this, there's a very simple, practical book on the use of nutrition and basic functional testing for mental health issues. It was called The Mood Cure by Julia Ross. Mm-hmm. And it was the most amazing book I'd read. So I'd been studying for 7 or 8 years at this point. I'd read thousands of books, and this book described very concisely this idea that there's a subset of people who there's true moods, which are real feelings, and then there are false moods, which are negative feelings based on low levels of neurotransmitters, toxicities, adrenal issues, all kinds of things.
Right, and we
so
don't feel the difference. It feels the same to us.
No, it experientially, it's completely the same.
Mm-hmm.
But so all of a sudden, I started to listen very differently to people.
Good.
And so I very quickly contacted Julia Ross and started doing some consultations with her. I went to do, she did at the time, it was probably about the year 2000, she was doing trainings for mental health professionals on the use of targeted protein supplements called amino acids.
Mm-hmm.
And amino acids like tryptophan, tyrosine, are the building blocks of the neurotransmitters that are the brain chemicals of mood. And so very quickly, and so in this weekend workshop, I learned about what a pro-mental health diet was. And it was pretty much, that was a long time ago, it was before people were talking about the paleo diet, but it was pretty much the paleo diet. It was real food, organically sourced. It was meat and as many vegetables as you wanted, good quality fats, low in sugar, low in processed foods, and what you would call frankenfoods.
Yeah.
And then I learned about the targeted use of assessing people for neurotransmitter deficiency symptoms. So serotonin deficiency, tyrosine deficiency, GABA deficiency, and then began to give recommendations, not prescriptions, because I wasn't a medical provider, but to educate people about the use of specific supplementation for mood issues. So issues like
it's a little
anger
bit what Professor Walsh also put out in his book, Nutrient Therapy of Mental Illness.
So it's similar but different. So I got to Walsh about 15 years later.
Cool.
So Julia Ross's work is focusing on what happens if you give targeted nutrients. Yeah. So if you give amino acids with the vitamin and mineral cofactors, B6, zinc, sometimes folic acid, sometimes B12, sometimes magnesium, to make more neurotransmitters. So Dr. Walsh's work, Dr. Bill Walsh, a biochemist out of Chicago, his work is largely focused on how do you understand what biotype someone is. So if someone is depressed, he did thousands of lab tests, and he said their depression is actually 5 separate disorders at least. So the 5 disorders, or some of the disorders, and he would say 80% of depressed people have one or more of these issues, underlying biochemical issues. One is methylation, how well they're able to build neurotransmitters, how well they're able to detox. 2 would be the ratio of copper to zinc. How much do they have? Too much copper and not enough zinc. 3 would be pyroluria, which is a genetic condition that when hemoglobin is made, that B6 and zinc are made significantly lower. And remember, B6 and zinc are cofactors essential for making the neurotransmitters. So without B6 and zinc, you're going to get depression, you're going to get anxiety.
Absolutely.
You're going to get, you might get anger, you might get fluctuating mood symptoms. So I came to his work way later. So I ended up studying with Dr. Walsh maybe like 3 or 4 years ago. But I found these very, very simple changes helping people get off of sugar, helping people stabilize their blood sugar, helping people raise levels of whatever neurotransmitter they were deficient in, giving people a blood sugar stabilizing multivitamin, helping them transition to a real foods diet. That it made therapy so much easier.
It makes such a difference, and I'm glad that you're saying that. It is really huge. People don't realize how important it is. And you said in your intro, when we talked before, you said yet you realize that often medication and psychotherapy just don't do the job. They don't get completely well.
That's right.
And that leads you every day to change their diets and recommend supplements. And I'm doing the same thing and seeing the same results. And yes, health is a team effort, and I agree with you completely. They need it all. And many think, oh, I just pop a pill and I'll be healthy. It doesn't work for most diseases anymore.
Yeah, I think diseases are so much more complex now.
especially the chronic illnesses. I mean, yes, when you break your arm, you go to the emergency room, get it fixed, fine. But if you have something chronic or mental health issues, there's often so much going on. And I'm glad the more people do what we do, the better it is.
That's right. And the thing that was amazing to me was that taking these very simple steps. So I wasn't I'm not a physician like you are.
Yeah.
And the question was like, of course, I didn't want to overstep my boundaries either as a therapist or as someone who's out there practicing without sufficient knowledge base. And so a lot of the things I've focused on, and I've gone deeper over time, like I've taken on different pieces of the puzzle. Because I think, as lots of people would say, the brain is the most sensitive organ of the body.
For sure.
So likely it's going to be affected by many, many different kinds of bodily imbalances. So food sensitivities, mold toxicities,
heavy metal
bacterial
toxicity,
yeast infections. I mean, there's so many things. And the thing that I see is that mental health as a field is so unaware of the many possible root causes of symptoms.
That's so true.
And a lot of what I do is try to learn more and more and more, like we all are trying to do.
Right.
Because it can be very complicated.
And
in my experience, sometimes it can be quite simple. So I just had a man come to me yesterday who I'd been seeing a very long time. He has had sort of chronic anxiety since childhood. He's in his late 20s. And finally, after maybe 3 or 4 years, he said, okay, I'm going to do the diet you're suggesting, which is just a basic elimination diet.
Right.
It's called this one's called Whole30, but it's a basic paleo elimination diet that takes out foods that are
mainly
thought
dairy,
to be allergenic and inflammatory.
Yes.
So he did it the way you're supposed to. He got clean took out all these foods for a month, and then introduced them systematically back one at a time. And so he introduced beans. He had no reaction. He introduced gluten-free grains. No reaction. He introduced dairy, and he had a terribly upset stomach. And then he was like, that's interesting. Then he went back to Whole30 to get clean again. He introduces gluten, and he has pain that he hasn't had in the whole month he had started this diet, and he hadn't even realized it. Joints were hurting. Muscles were hurting. Yeah. His anxiety goes from 2 to a 7.
Wow.
10 being like really extreme.
So I think we'll just interrupt there. I hate to do that to you, but we have to go to the commercial break. And I would love to hear more about how people change with simple diet changes, how their mood changes when we come back after the commercial break. So tune in after the commercial break with more about mood and nutrition with Dr. Josh Friedman. Thank you. Hello and welcome back to Healthy Alternatives here on 97.5 CIOE-FM or on the web at communityradio.ca. I'm your host, Dr. Christine Sauer, and today I'm talking with Dr. Josh Friedman, psychologist and a functional nutrition practitioner. In the first half, we were talking about what his story is, why as a psychologist he wasn't satisfied with just talking to people, and how really small changes in nutrition can massively affect mental health. Thank you for being back. Josh, it's a pleasure having you on.
Thank you again.
And let's talk a little bit more about, I had to cut you off a little bit, about clients that change their nutrition and discover that a food allergy or toxins or inflammation is at the basis of their symptoms.
It's not every person, of course.
No, of course.
So there's so many root causes. So I usually refer to the root causes as the general suspects. And so
Nice.
Our job is, Dr. Walsh says, you can't test for anything, so you need to think algorithmically. You need to think about what the most likely suspects are. And you want to intervene in the cheapest place that's most likely to have the greatest benefit.
Right.
So the thing we do every day, the thing that we do multiple times a day is eat. And so nutritious foods can be inflammatory for us. So if you have any sort of autoimmune condition, things like potatoes and tomatoes, nightshades, eggplants can cause a lot of inflation.
Yeah, it can really be any food theoretically, but the most common culprits, as you say, is dairy
and wheat.
Gluten-containing grains, and of course eggs are often there, yeast is often there.
Correct.
And as you said, the nightshades are often there. So you have to really do a good assessment, and I'm sure you do that.
Yeah. And one of the things we do a good assessment, I mean, sometimes we do and sometimes we don't. So sometimes we're going to do elaborate food allergy testing if someone has resources and they're interested. But what I usually tell people is the cheapest and most reliable source of food allergy testing is take a food out for 2, 3, 4, 5 weeks, and then introduce it 3 times on one day, and go clean, meaning take the food out for another 2 days or 3 days, and just watch what happens. Watch what happens when you remove it. Watch what happens when you reintroduce it.
Yeah, so and that's a good way to do it if somebody has not very many allergies. It takes longer. And I disagree with that a little bit because it takes longer. And when you have people with complex allergies, they often don't take the offending food out that they really need to take out. But you need to test in any way. A food allergy test has false positives, false negatives.
That's right.
Some practitioners are not aware of that, and that's a shame.
Yeah.
But the elimination diet, I think, can be shortened very much if you do a food allergy test. But you're right. There have to be resources.
That's right. It can be very expedited. And if people are prone to getting disappointed quickly, as many people who have mental health symptoms, they've been through a lot. They've been through lots of treatments, and they may not have the energy, the fortitude to sort of go through the process of removing a lot of foods for a period of time.
Yeah, that is hard to do. It really is hard.
And it is. I mean, I've done it many times, and it can be really hard to do.
Oh yes, especially if you have to give up your favorite foods for some time, which it usually is.
And the favorite foods are often the ones that are the ones we have allergies to, right?
That's right. And you know, like I know, that there's gluteomorphine and there's caseomorphine that makes the people feel good and go high on milk and gluten-containing grains. And the sugar, of course, is like heroin for the brain. So,
this Julia Ross always says, "What are the 4 addictive white powders?"
I like that.
That were formerly innocuous substances. So she says, poppies turn into heroin. There's coca turning into cocaine, and then she pauses and she said there's flour, and then there's sugar.
Yeah, and
the 4
there's a milk too. Milk and cheese can be just as addictive. That's a 5th. That's not exactly a white powder, but I like the white powders. It's so true. Yeah, and it's sad because the old-time whole wheat grain wasn't as allergenic. I think the toxins that we are exposed to make us prone to it. And then, of course, the gluten has been very high concentration now in the flour, and the refinement is crazy.
And then the GMOs and the Roundup.
Right,
and
exactly.
I mean, it is kind of a toxic soup. One thing I'd like to say that you and I just spoke about on the break it is about the fact that many people go through the mental health system, and I've seen this a million times as a therapist. People go to if you go to your doctor, you have a short appointment, you tell them you're anxious or depressed, you're prescribed medicine. If that works, great. If it doesn't work, you're usually prescribed another medicine. If that doesn't work, then you're sent to a psychiatrist. Psychiatry, usually puts on a few more medicines. And in my experience, once you've been on 3 or 4 medicines, the likelihood of finding a medicine that's going to work is pretty unlikely. And many of those people that go through that process never get referred to a psychotherapist, either because their insurance or because psychotherapy by certain psychiatrists isn't that valued. And so people get to the end of the line where they're told, this is the best we can do for you. And then they're given like very extreme radical treatments like electroconvulsive therapy, ECT, or TMS, which is not as radical, but it's kind of a pretty invasive treatment.
Or now the ketamine infusions.
And
short-term
my big
solutions.
thing is about informed consent. It's about educating people about what their options are. And so there's so much research out there. Like if you dig into the literature, none of the work on nutraceuticals or food changes isn't based on the literature. It's all in the academic literature. The role of toxins, the role of bacterial or viral infections.
It's all there.
And there's so much more that people can do. And the thing is, how do you find knowledgeable practitioners?
It's hard. It's by
because
everywhere.
Going to your normal doctor, like if someone is listening now and they give this to their doctor, the doctor's going to say that's bogus. That's not real.
Right.
And the truth is, there are hundreds and thousands of well-trained practitioners, some medical, some life coaches, that are getting trained up in nutritional mental health approaches.
And some are naturopaths, and some are
there's naturopaths,
there's different
for sure.
practitioners,
nutritionists.
And I always say, ask your practitioner what his background is, what he learned, what his beliefs are, what his values are, and what he believes. And if he believes the only thing that helps you is a pill, maybe you should get a second opinion.
That's right. And in my experience, so I'm not anti-psychiatry.
No, I'm not either.
And I think there's a certain percentage of people that go through the traditional system, they get what they need, and they're back on their merry way.
Yes.
And I actually have no problem with that. I think there are acute dangers for psychiatric medicines for a very small percentage of people. And then long term, if there are more natural approaches that people can find, I encourage that. But I'm not anti-psychiatry. The thing that gets under my craw the most are the people that are told that there are no other options.
Yeah, I hear you.
And so
you should give people
I just want to give people a few places that they can go and their databases.
Yeah. But we are very much going to the
for
end.
Providers.
Josh, I would recommend just give them your website. I know there's tons of information. You have a great Facebook group. And I would love you to share that before we have to go to the end so people can connect with you.
That would be great.
Yeah.
And I'm good with email and answering questions. And really, I'm in this. I'm mostly a psychotherapist, and I have a side business. And I do some nutrition and some kind of functional work within my psychotherapy practice. But because I'm not licensed as a medical provider, I have another practice where I do phone consultations.
Sure.
And I do education, and I do more nutritional psychiatry-focused things. And that business is called Mood Healing, MOODHEALING.com. And I have lots of blogs on some of the root underlying issues connected to mental health.
It's an excellent
resource. You can learn
resource.
about me, and there's a way of contacting me with any questions you might have.
And absolutely, I recommend that you contact Josh. He is very knowledgeable and just a great guy. And as you said, you're not licensed to practice, neither am I. I'm working as a health coach. So we educate people and point them in the direction and give them the hope that there's more out there than just medication and psychotherapy, and it's always a team approach. Thank you so much for being on the show, Josh. It was a pleasure.
I had a really good time, Christine. Thank you so much.
Me too. And this brings me to the end of today's show. Please don't hesitate to contact me with any questions, thoughts, comments, or suggestions. Or if you'd like to contact Josh and forgot his website, my email here is christine@communityradio.ca. Or you can contact me through my website, docchristine.com, and I'm always grateful for feedback. I also want to extend a special thank you to today's producer, Ron Goyash. Thank you so much. Thank you all for listening to Healthy Alternatives. I'm your host, Dr. Christine Sauer. Tune in next Thursday at noon on 97.5 CIOE-FM Community Radio with live stream on communityradio.ca for the next episode. Goodbye and have a great day.